Thank you very much. Good evening, the Kajiado we want. We thank you for tuning in to our platform. This is the Kajiado we want. We are back on. Sorry for the technical itch that we've experienced. We apologize for that. We're going to begin the section afresh because we know the topic for tonight is a very important topic, especially for us parents who have teenagers and youngsters and even our family members. Um, and the topic for today is basically dangerous trends, what parents need to know about drugs. But before we begin, we need to thank of the rain that has been falling we need to thank health. We also thank God for that are being done. We are grateful to God, and we pray that the leaders will continue to collaborate with the community in making the Kajiado county a county that people can be proud of. Before we begin the topic for tonight, I would like to welcome our chairman for the Kajiado We Want, Mr. David Dome, who is going to give us some announcement and also give an introduction of what the Kajiado We Want is all about. Welcome, David.
Thank you very much, and good evening. My name is David Ndome, the interim chairman of the Kajiado We Want CBO. At this moment, I want to welcome all of you, the audience. Feel very much welcome to this forum where we are discussing the dangerous trends in drugs and substance abuse. And it is a topic that each and every parent need to listen to. I want to introduce the Kajiado We Want community-based organization, which is all about development and community issues. At this CBO, we focus on 8 key areas, and these are infrastructure, water and sanitation, environment, security and community policing, job creation, trade and industry, education and literacy, as well as health and wellness, and number 8, advocacy for the vulnerable groups. The vulnerable groups in this case consist of the people living with disability, women, children, and youth, as well as elderly. How do we achieve our objectives? It is through, 1, creating awareness through discussions like this every Wednesday from 8 to 9 p.m. Number 2, through lobbying county and national government, through public participation, through memoranda, sometimes petitioning, and even picketing. And I want to say today we participated at the budget and appropriation public participation in Gong Social Hall, where we presented our views as the people of Kajiado CBO. And number 2 is, or number 3, the last one, is about partnership and doing what we can as a CBO by partnering with individuals, corporates, entities, other CBOs, and NGOs to just do what we can using our little means. And what we do, for instance, this Saturday, we shall have a hike and meet session at the Olorua Forest, where we want to adopt a forest where we shall be growing trees. And we welcome everyone to come from 7 a.m. We shall have the hike and picnic. For those who want to do nature trails of 10 kilometers, you are welcome. We have 5 kilometers, you are welcome. And for the least 3 kilometers, you are welcome. So we shall do flag off at 7, at 8, and at 9 a.m. After which, there will also be fun, a lot of family time, for dog lovers who needs to walk in the forest, and especially the people of Kajiado North, this is an opportunity for you to come and see where you can be doing your walks. Thank you very much, and back to you, moderator.
Thank you very much, David. It is one thing to talk about our government, and it is another thing for us to ensure that we are participating in issues and things that matter most to us as the people of Kajiado. Now, today's topic is one of the most important topics in all our households in Kajiado and basically throughout the country. In our households, we have individuals that have fallen to drug use and drug abuse, and Nyambura is going to take us through tonight on, as parents, the things that we need to know about drugs in order for us to be able to help our youth and to help our family members to be able to avoid them, and also to be able to help them to rehabilitate them back into the normalcy of existing. Nyambura, please welcome. Let us know who you are, what you do, and basically after the talk, you can be able to let us know how you can help us further just outside this talk for tonight. Thank you very much. Welcome, Nyambura.
Thank you very much, Regina. Good evening, everyone. And thank you once more for joining us in this very important session organized by the Kajiado We Want. And today, I will be taking us through a very interesting topic, dangerous trends and what parents need to know about drugs. My name is Nyambura Kigera, currently working with NACADA. I will shortly introduce who we are as an institution. I work as a trainer, as a compliance officer, and I handle policy and legal matters where I assist in legislative work and policy development. So allow me to share my screen with you. And as I do that, I'd just like to introduce who NACADA is. And NACADA in full is the National Authority for the Campaign Against Alcohol and Drug Abuse. And we are a state agency or a state corporation under the Ministry of Interior and Coordination of Government, established by an Act of Parliament, the National Authority for the Campaign Against Alcohol and Drug Abuse Act of 2012, to, among others, coordinate a multi-sectoral campaign against alcohol and drug abuse. And these we do through policy formulation, through public education, through counseling, treatment, and rehabilitation, as well as through compliance and enforcement of laws that are enforced. And as I have mentioned, tonight we will be looking at what we can do as parents as we address the challenge of alcohol and drug abuse, or the menace that is affecting us as a society. Of course, we know that as parents or as families, we are the very first point of interaction, or where our children should be getting information from. Unfortunately, with the advent of technology, our children are also able to get information from other sources. But we ask the question, what can we do as parents? Of course, we thrive and work very hard as families, as parents, to bring up our children as best as we can. However, we find that most times we are not spending so much time with our families or with our children because of the normal busy schedules we have as we try make a living, and we do not have time to talk to our children. So we have concerns, especially where our children start using drugs. And we know that drugs include the legal ones, tobacco and alcohol, that are legal in our country for adults or for people over the ages of 18 years. However, it's unfortunate from research and from our common knowledge to know that at times we are finding our children under the ages of 18 using and accessing tobacco and alcoholic drinks. For the illegal substances, we have marijuana, cocaine, and heroin as examples. And even these, we will be looking at some statistics that are showing us that our children, as young as 6 years, 5 years, have begun interacting with drugs, including prescription drugs. And of course, research from an international body, the National Institute of Drug Abuse, has shown that it's very important for us as parents to be part of our children's life, to ensure that we prevent their use or initiation into the use of alcohol and other substances or drugs. Of course, as our country, we are saying that we're in the middle of a parenting crisis. And why is this? When you look around us, there are so many things that are happening. There's so many vices that are around us. Of course, matters drugs is just one of the many issues that as parents, we are dealing with. And while parenting is a very rewarding venture or a very rewarding task, it's also very demanding. And at times, as Triza had earlier mentioned, at times comes without preparation. And we are struggling with demands of this life, where on one hand, as a parent, and especially within our urban areas, where I need to work, and probably where I work and where I live would take a bit of a distance before I could get home. And at times then we are not getting enough time to nurture our children, to keep them safe, or even just guide them as they grow up and become independent and well-adjusted members of our communities. And of course, this is scary. The information we are getting, the news that we are seeing from our media, our social media, and just by interacting with the community all around us, we find that this is a very scary time to be parenting, or a very interesting time to be bringing up our children. But of course, we are saying that as parents, we have the power to prevent our children or to just help our children from getting into the use of alcohol and other drugs. Because we know again that while we have legal drugs, the tobacco and alcohol that I have mentioned, that we are using as revenue for our country, of course, the substances also have very detrimental and serious side effects, and those that are especially associated with the health of a person. So we will ask our question, or we will ask ourselves, why do we find people using drugs? And people, these include the people within our community and our young people. So we divide these into three categories: individual factors, family factors, and community factors. So for the individual factors, at times we say that some people might not know what the harms or dangers of use of substances are. So you'll find a person starting to use a substance unknowing that the same substance will cause harm or affect their health. Another reason a person could use is because of peer pressure, where if a young one is interacting with friends who are using, then there is a likelihood that they will get into substance use. Third, we have poor role models, and this is where we are coming in as parents or as guardians. We find that at most times, or from research, our young children are getting into substance use because the people who are around them, their parents, family members, are using substances. And in most cases, our children will model what we are doing as adults. We also have family factors, and at times we will find young people using substances or drugs because of marital conflicts, because of family breakdown. So these will cause them so much stress and so much anguish that they will find themselves running or seeking solace from substances that, yes, could help them short term in dealing with these or as a coping mechanism. So for instance, if a person is using alcohol, they will find that whatever emotions, whatever issues they are dealing with will be depressed, will be, in a way, because alcohol is a depressant, will at that point, make them forget what the issue is. But when the effects of these substance or the drug wears out, then the person finds themselves still dealing with the issue that they had at hand to begin with. Of course, parenting styles could also affect whether a young person uses drugs or not. And we find that at times as parents, in the best interest of our children, we'll be very authoritarian, that whatever rules I make or what I say under my rule has to be done. But the generation that we are currently raising, the generation that we are calling the Gen Z, are people who are able to stand up against you as a parent and actually question the rules and the decisions that we are making. However, then, how do we balance being a parent, putting your foot down, having your child participate in decisions and just protecting them from getting into substance use? And that I'll be looking at shortly. The third reason or the third factor why a person could be using a substance, and especially the young ones, are community factors. So we find that we have laws in place, some of which are the reasons why the Kajiado we want is in existence to ensure that they are advocating for the application or the compliance to laws that are in place. So we find we will have weak laws that allow people whose aim is to make money to sell substances or drugs to our young people. So while the law is in place to protect our young children or our young adults, then we find that at times there are people who break the law and make these drugs and substances available and accessible to our children. Of course, other things within the community factors would include positive attitudes, as well as norms and beliefs about alcohol and drugs. And I'm sure some of us have had myths that would tell us, for instance, that if you have an issue, say a flu, a common cold, if you take, say, a shot of a whiskey, then that could help heal you. So that happens to be a positive attitude on the use of a substance. And this could lead to some people getting initiated into substance use just because from growing up or what they have been hearing is people positively talking about substances and praising them and also connoting them to have very positive effects. So what's the Kenyan situation? What statistics do we have that are showing us that we have a problem in the country? So in 2016 and 2018, NACADA carried out some studies within our secondary schools and primary schools. And you can see that our young people, and remember the people within our secondary schools are people who are within the teenage year, 13 to about 18, while in our primary school, we are talking about people who are within the ages of about 6 and 12. So as young as those ages, we are finding people or our young children using substances. So in terms of alcohol, for instance, 23.4% of the people sampled, and we are talking about over 3,000 schools that were looked into in these two studies. So 23.4% of the students sampled were already or had used a drug or alcohol in their lifetime. For primary schools, you will find that 7.2% of our children had at one point in their life tasted alcohol. And what is this telling us? That probably because we have a law in the country that prohibits the sale of alcohol to young children, then there is a likelihood that our children are able to get these substances, say from our homes or from adults who we entrust them with. Because remember, a person under the ages of 18 years cannot buy or access an alcoholic drink. So for CAT or MIRA, for ever use, which is prevalence, when we look at prevalence, we are looking at any person who has ever used a substance, while the current use is use that had happened within 30 days of the survey or the research being carried out. So prevalence for MIRA was at 17% in secondary schools, while in primary schools, we had 3.7%. And again, you remember that Mira in our country currently is a cash crop, or we are growing it as a source of livelihood. However, research has shown that the use of cat or mira has negative effects on our bodies, including psychosis, which is a mental health issue. For prescription drugs, which are very common in most of our homes, and when I talk about prescription drugs, I am talking about drugs that we are able to purchase from pharmacies, from chemists, drugs that we are given in hospitals. So these are legal drugs and drugs that we are using to cure ailments. So in secondary schools, 16.1% of the students were or had used a prescription drug, while in primary school, about 10.4% had ever used a prescription drug. Remember, for these, their statistics could be a bit high because remember, prescription drugs are drugs that you are accessing because you're probably gotten them from a hospital. For tobacco, and tobacco includes shisha, includes cigarettes, prevalence was at 14.5% in secondary schools, while primary schools were at 6.0%. I'd like to mention that we currently, or in 2022, we did another survey that showed that our young people are starting to use tobacco from as low as 6 years. And 6 years is a person who is joining grade 1. So as young as 6 years, tobacco, which is not sold to young people, is accessible to a person of that age. For bang or marijuana, as we call it, or even cannabis, we had 7.5 of our primary school children using, while 1.2 in our primary schools were using. We had other drugs that include inhalants, and inhalants here would include the glue that we find our young street boys and girls sniffing. Could also include other things that we find within our homes, paints, aerosols, simple things including paint, shoe polish. These all would fall under this group of inhalants. So secondary schools, and this is just in them trying to improvise where they are probably not able to access these other kind of drugs. So 2.3 of the students were using, while 1.2 in the primary schools were using. For heroin and cocaine, you will find that the statistics are a bit low, and the statistics were also the same in terms of prevalence and current use. So the number who had used in primary, for instance, who had ever used heroin, were also the ones using within the 30 days when the research was carried out. So for heroin, secondary schools, the figures are a bit low. However, very scary as well, because remember, these are drugs that are very expensive and not easily available in the market. From those two surveys that I have shared, one carried out in 2018 in secondary schools and in 2016 in primary schools, some of the factors that were mentioned as risk factors, and risk factors, when we talk about risk factors, we are talking about factors or things that would lead a person into use, because we have risk factors, which are factors that are driving you towards use, while protective factors are factors that would help safeguard you from getting into a vice. So the risk factors that our students or our young people are mentioning was one, living with a single parent who is a father. And here I will be talking about it with due respect to our single parents who are fathers. We had children feeling that those who are living with a single parent who was a father were more likely to get into drug or substance use. And the reason for this is because they felt most of what our fathers do is that they make sure that we do not lack. So they are perfect providers. They make sure we go to the best schools. They make sure we get the best things we have, but they will most of the times not get involved in the day-to-day running of our lives. So fathers will come home. They will be too busy to deal with our children, to talk to our children. And most times where you find it's a two-parent family, at times that role is left to the mother. So having a single parent who was a father was pointed as a higher reason why people are, or why our students or young people are getting into substance use. Another risk factor cited by our students was high amounts of pocket monies. And our children were feeling that at times as parents, in just trying to make sure they do not lack. And I know one of the attitudes we have as parents is that I will not want my child to go through what I went as a young one. So we make sure we smother them, we provide to them, and they felt that no, you need not give me a high amount of pocket money, because the more fluid I am, the more disposable income I have, then I have to find a way of using them. The third reason was a family member, or the third risk factor was a family member or a friend using alcohol and drugs. And these I had mentioned as I was looking at the reasons why people are using psychoactive substances or drugs. And the students felt that where a family member, and this could be a parent, an uncle, an aunt, a grandparent, were using alcohol or drug, then they were likely to start using. Because remember, then they mirror what we do, they model what we are doing as the adults or the authority figures in their lives. The fourth risk factor that was given was that if one is not a member of an active member of a religious group or a club, or they do not have something to do during their free time, then they felt that they were more likely to get into substance use. Because remember here, an idle mind is the devil's workshop. So as parents, if we can we get our children involved in groups, study groups, dance groups, let them do some sort of extracurricular work. So what does this mean for our families? We said that the family is the primary socialization agent. And while it can be a protective factor for our children, there are instances where it becomes a risk factor. And here it is where most students were reporting that they were using alcohol or substances at home or while they were on their way to school from home. So where then are they getting these drugs or this alcohol? They're either getting it at home or they have gotten it while they're on their way to school, probably using the high pocket money that we have mentioned that they had gotten from their parents. However, people, I know the statistics look staggering and shocking, but please let us not panic. Not all our young people are abusing, using, or even dependent on drugs. However, while this is said, our young people are indeed exposed to alcohol and drugs. And just let us look at our televisions, for instance. We will find numerous advertisements on alcohol. We will find depiction of alcohol and substance use being glamorized in our televisions and in programs that our children are being exposed to or what they are watching. But as parents and caregivers, we play a very key role in helping empower our children to make healthy choices and ultimately get them not to use drugs. And of course, the reason we are very keen on ensuring our children do not start using drugs is because we are seeing that the human brain matures at the age of 25 or thereafter. And if it is exposed to substances before it matures, so if you expose a child to substance or drug use before they get to the age of 25, they are more likely to become dependent. And when I talk about dependence, I'm talking about addiction. This is where a person will have a compulsive or an overpowering desire to continue taking a substance. And in most cases, this desire takes precedence over any other activity or thing that they would want to do in their lives. So if we can get or we can delay initiation of substance use for our young children until the maturity of their brain, this is 25 years and above, then we are saving them from becoming dependent and addicted, knowing that the cost of rehabilitation or even healthcare in this country is very high and expensive. So what can we do as parents? Here I will be giving us 3 very simple guides or tips that we can use as parents to help us engage with our children, protect our children, and safeguard them from using substances and drugs. So what am I talking about when I say be responsive? Responsiveness is just being a safe space for your child. Ask yourself when I talk about these, can your child openly and confidently come talk to you about anything. For us who have young children, I have one who is 11 years. Am I comfortable if my young one came and told me that they have a liking for a child of the opposite sex? Or if they came and just told me, you know what, mom, I have started using a substance. Would they comfortably come to talk to me about that? And the reason why we want to be responsive in our children's lives is to just foster communication, open up room for them to relate with us, and just believe that they can tell us anything. And just know that no matter what I have done, I can talk to my mom and dad, and they will not judge me. They will actually be a source of help. So we can be responsive by improving on our communication, because we know that communication in any sphere of a relationship is a very strong foundation. So if we are able to communicate well with our children, we are able to foster good relations. We are able to find out whether there is any change of behavior. If there is a problem, then we are able to identify it earlier and resolve it in good time. So responsiveness helps us reinforce and support positive desired behavior, because again, as we communicate, we are telling our children that as a family, these are our values. These are the things that are right. These are the things that are not right. And once we see our children doing the right thing, then we will constantly reinforce it, congratulate them, give them a pat on their backs. While if we find that they are doing something that we are not prescribing to as a family or as parents, then we are able to correct that behavior before it becomes too late. And how can we improve communication? Let us learn how to question our children. Looking at the way our schedules are busy, most of the times when we come home from work, all we ask our children is, how has your day been? And while I am asking these, most of the times, probably as a parent, I'm very busy because I am tired. Probably I have work that I need to complete that I had carried home. I probably need to get into the kitchen and start cooking. So we hardly ever get time to communicate well enough with our children. But if we learn how to question, then we are able to get much more information from our children. So questioning shows an interest or a concern, where I am asking my child, how was your day? What was interesting about your day? What is a new thing you learned? What was good about your day? I tell parents that in questioning, I found a very easy way of doing it. I will ask my child, please detail for me all the roses that you had in your day today. And roses in this instance is any good thing that you are able to witness or have in your day. And our rose in his life or her life is as easy as there was no traffic in the morning as we were going to school. On the other hand, I also want to know whether there was something bad that happened to them. So I will ask them, were there thorns in your day today? And again, those were things as simple as, today in school, we did not have my favorite meal. So that way, then we are able to just engage and spend much more time together. Questioning also encourages problem solving, because when you are questioning your child and they give you an instance or a scenario where they had a difficulty or an issue, say at school with their friend, then you are able to ask them, how did you address that? Yes, your friend did something that you did not like in school. Were you able to address that? Because again, remember, at times as parents, we want to solve all the issues that our children are facing. But then again, are we helping them? But by constantly and always being there to caution them, knowing that we are helping them develop into adults. And as adults, we will not always be there for them. So once we question, we are helping them. At times when you are told an issue as a parent, kindly ask them whether they have a solution or how they think they can best deal with an issue. Of course, communication is also well done by listening and observing. So let us learn to listen to understand. When a child comes and tells you something, if say a teenager comes and tells you, you know what, mom, my friends were smoking and they gave me a cigarette to smoke. Let us try as much as possible not to be reactive. Let us just listen, try and stay calm. I know this is hard, especially coming from an African culture where, you want to react, you want to punish, you want to stomp your authority. Let us try to listen, to understand. So ask, so your friends were giving you tobacco. What do you know about tobacco? Remember, some of the instances that present themselves also become teachable moments. If you have had issues addressing issues of drugs and substances, while you are questioning, when you are listening, when you are observing, then that becomes a moment where you can introduce a topic and get to discuss it with your child. Of course, don't accuse. When a child is being vulnerable, coming to you, trusting you with their issues, it doesn't matter what they tell you. Remember, we are being responsive. We are being a safe space. So try as much as possible to listen without accusing. Yes, they could be on the wrong, but remember, they have trusted you enough. They have felt it safe to come to you with the issue. So first listen, understand, then try and correct them. Remember, we have said that as parents, we need to reinforce good behavior, correct bad behavior, but we do not correct by accusing our young ones. Thirdly, let us try to reduce our emotions. African moms, I hope you're with me. Let us try to be calm. When a child does something, when a child tells you something, just stay calm. And that times we use the acronym CALM to just talk about it. Control. The C stands for control. So if it's your emotions, just control it. You could be angry, you could be alarmed, but don't show them that you are alarmed, that you are angry. The A is analyze. Analyze. Is this a situation I want to handle now? Is this a situation where probably I want to wait for the other parent so that we can address together? Am I in the emotional state of mind to address it now? If not, then we move to the L. The L is leave. So if you are talking from the sitting room, please go to the kitchen, please move to your bedroom, please step out of the house, because you want to organize your thoughts to be able to address the issue without causing damage or hurting the child because of probably the words we say or how we say them. And of course, the M is making time to address the issue. And here we are saying where you are not able to address it instantly, make time to address the issue within 24 to 48 hours. Because you also do not want to wait too long for the issue to have simmered down, cooled down or simmered down. You want to address it when it's still, everyone can remember what's happening when it's still very hot. Of course, remember, strong feelings interfere with clear thinking. So let us try to communicate very well with our children. And as I have spoken, the CALM is just an acronym that can help us control your actions or thoughts, assess and decide whether you want to do it now, leave, or make a plan to address it. So the second tip I'm giving you, parents, is provide structure. And how are we providing structure? We are providing structure for our children by having rules and boundaries, and also giving some sort of limit, because we cannot just let our children do what they want to do. We know that the world we are living in also prescribe rules for us to follow. For parents, for instance, we have traffic rules that we have to follow each and every other day. So even in our homes, let us try as much as possible to have rules and boundaries. And we know that our children will need affection and a structure to help them develop into secure, happy adults. Let us have some routine that the child can learn from, or that they can help build into a habit. So if a child wakes up, let them know that they need to make their bed, they need to brush their teeth, probably take a shower, and not just wake up and decide, today I'm not brushing, today I'm not making my bed, because then it means they are not creating a habit, they are not forming a habit. If it is in the evenings when they come home from school, let them know that you cannot start watching TV before your homework, for instance, so that they're also learning how to prioritize. And the routine then becomes very easy, because remember, a behavior repeated builds on the character of a person. How does setting limits help? It helps them in self-control. If a child knows that they cannot just watch TV at whatever time they want, they cannot use a gadget, for instance, as they please, then it helps them to self-control, because if a child knows that I can only use my device for an hour, then they will have to make a decision. Do I use it at this point or later on in the day to keep myself busy? Of course, they will also become responsible, because remember, the limit tells them that this is what you are required to do. That way, they're able to take responsibility and say that this is what I need to do as a person. And if I don't do it, probably my parent will not be happy. Of course, structure gives order to a family, gives a sense of safety and belonging. It brings about rituals, things that we are able to do as a family, gives a sense of belonging, and of course, passes value on to our children. Remember, when we are doing the rules, boundaries, and limits, it's very important to involve our children. At times, we will make the rules that we cannot use phones while we are eating. We can not watch TV during weekdays. So when we are setting the rules and boundaries, let us try as much as possible to involve our children. Public participation, remember, it doesn't mean that always when you have them participate, you are going to put the things they've said, but it allows you to communicate to them, explain to them why these limits are important. I have said that you cannot watch TV because it's interfering with your academics, with your education. You need time to study after school, which you might not do if you're watching television. At times, it also helps where you set rules to have the child acknowledged by putting a signature or their name. That sense of ownership, they feel important, they feel valued just by having them involved. How do we build structure? Having clear rules, I have mentioned. Let us set rules. Let's be very consistent with the rules. If I say that you cannot come home after 6, if you come after 6, then there should be a consequence to it. Because remember, if you are not consistent with the rules, then it just becomes a statement you say or a thing that is on paper. Of course, structure the routine as part of life as much as possible. So if it's a chore, you're not putting it as something that the child is doing to help. It is, we all participate in chores in this house. It is part of our life. Rituals, having rituals such as having a meal together as a family. At times we are very busy, that once food is ready, then the children can eat. But once we decide that as a family we can sit together and have a meal, this helps our children know that, no, we can sit together. We feel, we belong to our family, we belong to a park. And during some of these rituals, then you're able to engage, you're able to communicate and be responsive. Remember, at times we are saying that we are very busy. We might not even be able to do it during the week. But how about setting a weekend, a Saturday, where you have one meal together as a family? How about taking family holidays or even going to church together? That actually is part of the routine. And as we have said, we have structured it already as part of our normal life. The third way of building structure is disciplining our children. Of course, now with human rights issues, we believe that we cannot cane our children. But let's remember that the good book tells us, if you spare the rod, you are spoiling your child. I do not mean that you always have to discipline by caning, but discipline, whichever way you want to do it as a parent. It could be as easy as withdrawing privileges. Privileges here could include using telephone, eating off snacks, watching television. Those are privileges or things that this child likes. Having quiet time or time out in a corner can also be a form of discipline. For our children who probably likes doing extracurricular activity, then having them not participate in those extracurricular activity, not going out to play with your friends, could also be a form of discipline. And what I keep reminding, or we keep reminding parents here is, please follow through each time a limit is stretched or a rule is broken. As I have said, if a child is supposed to use a device for an hour, if they stretch it, they go beyond an hour, even with 5 minutes, unless there's a very good reason, kindly ensure that you discipline them, either by withdrawing that device or any other form of discipline that you want to meet as a parent. Of course, offer encouragement each time a rule is followed. Remember, we are forming to have them have a habit and build their character. So each time they do something good, please pat their back, encourage them. Kindly let them know that I have seen you following the rules, and I'm very happy that you're doing it. That tip that I am giving as I near winding up is being involved. How can we be involved? We can be involved by spending time with our children, just nurture the relationship we have with them, and to show them that we care. And this does not mean that we are not recognizing how busy we are as parents in this day and age, but as much as possible, can we try and spare some time to spend with our children? Some of us have our children with us, some of us have our children out in schools, but once they get home, can we kindly have time where we can just observe them? And we know our children. We always say parents are the people who know their children. If there is a bit of change, you are the one person who will be able to recognize that change, but this only happens if you are involved in the well-being of your child. We can be involved by supervising them. And here I'm saying, for those of us whose children are in school, try at times to call the school and find out how your child is progressing. If you can, pop into the school where we have our children in boarding schools. Just pop in one of the days, just engage the teachers, find out, is my daughter, is my son okay? Of course, this, as I have said, will help us to just identify and establish if there is an issue. Of course, we feel, for instance, when our children are growing, and especially as they are developing into teenagers, we feel we want to have them become more independent. We want to stop supervising or monitoring them. But parents, remember, teenagehood, young adulthood is the time we actually need to be in their lives. Remember, we say as young children, the children are more likely to seek you out as a parent. They want to come to you, they want to give you their stories. But as they get into teenagehood, they start withdrawing, they want their independence, they crave it, yes. That is the time that the door will be locked to their bedroom and probably with a sign that please do not enter. But enter that room. However, enter with knocking. Remember, we are teaching them to be independent, yes. Also showing them that you're respecting their space, their independence. So knock that door, but make sure they know that you will enter, whether they have a signage that says, please do not enter, as much as possible. So for us who have children in the pre-teenage, in teenagehood, young adulthood, kindly be more vigilant, kindly be more involved. For involvement, monitoring and supervising is one of the most important things. So supervise the schoolwork. Remember, at times we are now trusting them and leaving them to do what they want. Let them have positive learning habits. Encourage them to use books to stop being on devices throughout. At this point, you want them have about 30 to an hour of reading, if that is possible. Of course, be responsible of giving them information here. And key especially is sex education and drug education. Because remember, I keep saying that if you do not, as a parent, as a guardian, as a caregiver, give your child the information, they will definitely get it elsewhere. So we have phones, we have televisions, and most of us have access to internet. So if you are not honest enough to share this information with their child, they will seek it and they will get it elsewhere. An important note here is let us use age-appropriate language. For instance, when I'm talking to my 6-year-old, I'll be sex education, for instance. Here I will be teaching them about their sexual organs. And most of the times we will use, because probably of shame, we will use terms that we are hoping that are more respectful and more safe. So we will not call a penis a penis. We will not call the vagina a vagina. Yet they need to know these, because that way, if you are able to give them the correct name, then even in future, if anything happens, they're able to come openly and tell them, and tell you, mommy, somebody tried to touch my private part. If it's drug information, introduce them to alcohol. Tell them what alcohol is. You don't have to go into much details, giving them the chemical composition because of their age. But as they grow, then keep adding the information so that you are building onto what you already have started. Of course, monitor media and screen time. Get to know what they are watching, get to know what kind of music they are listening to. Use these also as an educative opportunity, so that if there is a movie they are watching, watch them together. Find out what they are learning from it. Are there any lessons they are taking home? Just kindly just get involved. Where possible, find out who their friends are. If it's somewhere where you can, find out the parents as well. Because remember, we keep saying we are teaching values to our children, but they keep interacting with other people. So where possible, ensure that the friends that your child is having are friends with this, who share the same values as you do, because remember, you want them to influence each other positively. So if you are able to talk with their friends' parents, then also just mention to those friends' parents that these are the values that we are observing, of which we believe in as a family, and we would appreciate and we would also want to know what your values are as a family, so that if you find that then the friends that your child is hanging out with or is friends with probably has different values, then you are able to also address that. Of course, talk and listen to their feelings and thinking. So just let them express themselves, let them talk out. If they're not happy, let them express that today I'm not happy. Let them probably tell you why they feel or think that they are not. We have seen that pocket money is a risk factor. Parents, can we kindly try to monitor the use of pocket money? Can we also just give enough pocket money? If you have shopped for your child, why do you need to give them much more money than is necessary? If they have money, teach them how to be financially responsible. If I give you 1,000 shillings, I'd like to see how you're using this money. Probably if we go out for lunch, I would also appreciate if you use your money to buy your own lunch, as opposed to always having mommy buy the lunch for you. Of course, spend time with them as much as you can. Of course, the recommendation where you have more than one child is to try as much as possible to have 15 minutes per child per day. Remember, if you have 3 children, these children would be different individuals. One could be a quiet one could be of a different temperament. Yet, if we mix them together, say we decide that we are watching a movie or spending time, one child might not be happy because they probably don't like watching movies. So, identify and establish what a child likes, an individual child, because they are an individual at it. And where you can, spend 15 minutes or even more per child. Have family activities and things that bond you together. Playing board games, listening to music, dancing, watching movies together, reading is a very good way or a very good family activity and bonding. Remember, parent, your opinion and action matters. So drug use prevention needs to start with us as parents, where we need to learn how to talk with our children about these very difficult topics. Sex education is not easy. I know as a parent, drug education is not easy as a parent, because at times I'm asked questions that I don't know. But it's also very important and good to admit that, yes, I am your parent. I do not know. But if you allow me, we can discuss that tomorrow. And also challenge you as my child, if you could kindly just try see what you can get on, say, uh, on a specific drug, so that as you are engaging, you are both sharing what you are able to learn. So children who learn about the dangers of drugs, underage drinking, and other risky behaviors from their parents are less likely to engage in them. Because remember, we have said, as an authority figure, their child knows that you have their best interest at heart. So when you tell them about these vices, about these risky behaviors, they are more likely to listen, even where they do not look as though they are listening and understanding. So what is my conclusion here? The drugs, and this includes tobacco and alcohol, are easily accessible and available to our children and adolescents. Kindly let's look around us. I'm sure for most of us parents, when you walk out, you will not miss an alcohol selling establishment, what we call the wines and spirits, near you. Remember, our children are also able to see these things. As a parent, we have a major impact on our children's decision not to use tobacco and alcohol, as well as other drugs. And therefore, we are urging or calling upon all of us to be responsive, to provide structure and be involved in our children's life, to, where possible, delay their initiation into substance use. And for those who have started using, to just inform them of the dangers so that they can stop. With that, ladies and gentlemen, I would like to end my presentation there and hand the program over to Regina. And as I do, I am leaving you with the toll-free NACADA helpline number. As I mentioned, NACADA is a government institution, and we offer free telecounseling services and referral services. using this toll-free number, which is free from our Safaricom and Telcom networks. So 1192 is 24 hours and it's free. So back to you, Regina. Thank you very much.
Regina, are you there? Hello, Regina.
David, can you proceed?
Okay.
David, can you proceed?
Okay, thank you very much, Nyambura. That was quite insightful about the dangerous trends and the NACADA work. I want to thank you and NACADA very much, because I think we've really learned a lot in terms of what to look out for, and also how to protect and prevent our young people from falling into this trap of drug abuse. I've heard about involvement as a parent, and I've heard about the dangerous signs, to look out for how a child is behaving, and basically the big role that we need to play as a parent. And more often than not, these are some of the roles that we fail to play. So maybe before we conclude, I have a few questions. And one of them I wanted to ask is, would you know what are the common drugs that affect our young people? What are these common drugs and where are they found? And yeah, just that. Where are they found?
Okay, thank you, David, for that. So in terms of common drugs, I will be reminding us of statistics that I have shared. Of course, the most common one and the most legal one is alcohol.
Mm.
We have said that alcohol at times is available at our homes. Remember, as we become more socialized as a society, we also feel the need to have these substances in our very own homes. So alcohol becomes one, of course, not for sale or shouldn't be availed to people under the ages of 18 under law. We also have tobacco. And this is mainly the cigarettes. Again, that should not be accessible or availed to our young children, but more likely than not are availed. We also have prescription drugs that are also becoming very trendy or very common with our young children. And as I've said, prescription drugs are drugs that are available in our homes. David, if I was to ask you whether you have any painkillers in your home, I'm sure
They're
you
there.
do. Yes, and probably they are painkillers you bought over the counter that were not prescribed to you.
Yeah.
But we are doing that to help ourselves probably when we get unwell. But then at times we are providing avenues where our children will take these drugs to just alleviate feelings or moods that they could have. So if I have, say, an antihistamine, my child could use it to just help themselves sleep where they're having difficulties in sleeping. So tobacco, alcohol, prescription drugs are very common, and these ones are legal. For the illegal one, we have cannabis being very common among our young people. And in a research that we carried out last year, and whose findings were released by our principal secretary on Friday, the age of initiation to cannabis use or bangi use was 8 years. So our children as young as 8 years are using cannabis. Remember, again, a roll of cannabis can be accessed or can be bought for as cheap as 50 shillings. We have cat. Cat is mainly within our northeastern region. Yeah, so those I would say would be the most common and easily available. You asked where we can get them. I have mentioned our homes. Unfortunately, we have shops around us who at times will not adhere to the law and will sell these alcohol and other drugs to our young ones, as well as peddlers that are now all within our community. So again, let's be vigilant. And if we see somebody who we are suspecting to be selling drugs or even other substances to our children, kindly let's feel free to report the same to NACADA or to other law enforcement officers. And the number that I have used, 1192, can also be used to report complaints or other issues that we see within our communities anonymously. Back to you, David.
Thank, am I there?
Yes, you are, David. I can
Okay,
see you.
good. Thank you. I think something has happened. Now, uh, how do we control alcohol? Because alcohol is legal, it is available everywhere, and it seems to be causing havoc to most of our young people. What would NACADA say about controlling alcohol?
Okay. In terms of control of alcohol, David, the most interesting bit is that within the East African community, I'd say as a country, we have one of the best legislation, the
Mhm,
Alcoholic Drinks Control Act of 2010,
mhm.
that controls the sale, manufacture, consumption of alcoholic drinks.
Yes.
But as we know, the role of liquor licensing was devolved to county governments
Mhm.
in the advent of our Kenyan constitution. And licensing is one means of controlling the availability and the sale of alcohol. So while we are trying so much as government to just regulate people, to control the number of people who are selling, we find that at times we have people who sell without going through the licensing regime. So you'll just wake up one day and outside your home, David, somebody has started a small kiosk, because I
Mhm.
don't know how cheap it is to start this business, but I hear at times with as little as 10,000, you can start your wines and spirits shop. So some people will do it without being licensed. This is where again we are calling upon members of our communities, where you are suspicious of an establishment and doubting their status, their legal status in regards to licensing, kindly just report. Again, as parents, if we can try as much as possible not to glamorize the use of alcohol, and glamorize here is where we are openly and comfortably using alcohol in all our celebrations. If my 2-year-old or my 4-year-old is graduating from PP2, most of the times you'll find that I have alcohol in that celebration. So as parents, again, we have a role where we need to stop glamorizing the use of alcohol. Thirdly, the county government, of course, we are pushing as national government to have county governments regulate the number of licenses that they are issuing. Yes, we understand that this is a source of revenue, but then when we look at the health implications, the cost of um, the use of alcohol on our people, then it's not worth the money that government will be making. So again, we are, as NACADA, have been pushing for county governments to ensure that first, they are not licensing establishments within residential areas. They are limiting the number of establishments that are being licensed just to ensure that we are controlling alcohol. Of course, it might not be a perfect solution, but we are hoping to start somewhere. Yes.
Yeah, thank you very much. I am getting more questions. Now, there is Germany. We know Germany has over 300 breweries,
Mhm.
but they don't have an alcoholic problem. Why is that so? Is our alcoholic problem a manufacturing one? Is it the type of alcohol that we consume? Because it cannot be the number. Germany has the highest number of breweries in the world, yet the people there don't have an alcoholic problem. We have few, or at least those that are known, but we have an alcohol problem. And I know right now the deputy president has declared war on consumption of alcohol, and especially in the Mount Kenya region where it is rampant and affecting the people. So, as NACADA, have you noted that probably we need to regulate manufacturing, because that could be where the problem is?
Okay. Thank you for that question, David. And again, I'll admit I've probably not looked at the German system. I think our focus mainly has been the UK and the United States, and in terms of how they address alcohol consumption. Yes, Germany seems to have a very large number of breweries because we are not even there. We are not even doing half of that. Currently, we have close to less than 150 manufacturers in this country. But what we're also finding is that while we have very few breweries or manufacturers, we are also importing so much of our alcohol. So the percentage of what we are using that is locally made could be just about half of what we are consuming as a country. And yes, as government, we are trying to just adopt or take a multi-agency approach so that when we are, yes, we are actually addressing our manufacturers, where we are inspecting them and licensing them as a team that sits. So we will have NACADA, we will have the Kenya Bureau of Standards who are dealing with standards going out as a team. We have the Kenya Revenue Authority who will also be part of the team. Members of the public health, the Ministry of Health will also be part of the team that goes out, inspects a manufacturing plant before a manufacturer is allowed to operate. Of course, this doesn't mean that we do not have the illegal or people who operate illegally or who manufacture illegally. You will find there are a few that we have been able to net or who have been arrested. And some of these has made it to our media stations, where you find that people are manufacturing, at times using the details of legitimate manufacturing firms and bottling the same or passing it out as a genuine product, while in fact it could be a counterfeit. So yes, we as a country or as NACADA has taken cognizance of that, and that is why our PS put up a team that goes out and carries out the licensing of the manufacturers. At this point, let me also mention that we are also licensing importers at national level. So while county governments are licensing retail outlets at county level, at national level, again using the multi-agency approach, NACADA brings together key players or key institutions that have a role in alcohol control to license and regulate the alcohol that is being brought into our country. And again, David, as you know, Kenyans are very people who are able to maneuver and at times get away with things. So we still have people bringing in alcohol that has not been licensed, that has not been regulated or checked by the Kenya Bureau of Standards. So we are still trying to handle that from an enforcement and compliance point of view. But we are trying mainly by licensing them and regulating the numbers.
Okay, thank you. I have two other questions before we close. Number one, does NACADA offer drug testing services? And number two is vapor, or is it vapor? V-A-P-E-R, a drug. Somebody says, as a parent, one can easily mistake it as a lipstick or a pen. I don't know whether you know about it.
Yes, I do, David. So I will handle the first question first. A parent is asking whether NACADA as an institution offers drug testing services. And unfortunately, the answer here is no. And I know this came post-COVID, where most schools would deal with suspicion of cases of substance use by sending children out for drug testing. Of course, there are facilities that would carry out these, mainly accredited rehabilitation centers, accredited medical facilities will carry out drug testing. But what I'd like to mention here, and especially if within a school setup, drug testing is just a component of a comprehensive program. Because if I test you, David, and find that yes, you're using a drug, that does not help you in any way. All I tell you is that yes, you're using, but then how best am I helping you? So we said drug testing be part of a comprehensive program where, of course, there is education, there is counseling, there is treatment if a person needs the treatment without just having it as a component. So yes, it will help. NACADA doesn't offer it, but there are facilities out there that can offer that. The question of vape, yes, vape is a form of tobacco because mostly what is contained in the vape is nicotine. So most vapes, David, as the person who asked the question mentioned, will come in the form of, say, a small lipstick. At times will look like a flash disk. So are very tiny portable devices that contain some liquid, and in most instances, nicotine in liquid form that is used electronically, is rechargeable, and people smoke it. So very common with our young ones because of the portability, easy access, because right now if you go online, search vape, you will find them in most of our online stores. So yes, vape is a drug because it contains nicotine and would have the same effects as tobacco. In some instances, we even say it's worse than tobacco because you are not sure what the liquid is. We are assuming it's nicotine because remember when vapes were being introduced, they were being introduced as tobacco use reduction therapy. So they were going to be an alternative to the use of cigarettes. But then again, manufacturers have devised a way of just incorporating other forms of drugs and not just the nicotine that initially was thought to be part of what is contained in the vapes. So yes, definitely a drug. And David, sorry, if I could just define a drug for us parents is anything that alters the functioning of your body. So if you take something that makes you think differently, behave differently, walk differently, then that is definitely a drug. And if it has a negative effect on your body, then that is what we classify as a drug. Thank you.
Thank you very much, Nyambura. You've learned a lot, and I'm sure we'll continue learning as we do our part as part of this society to try and control the drug menace in our country. As a person, I'm very delighted that the national government has picked this issue of drug and substance abuse with vigor, and we are going to see action. Some of us are people who had feared before to fight this big menace because it actually fights back. We'll actually be able now to come out, point out, and defeat for the sake of our future generation. You and your colleagues at NACADA are doing a good job. We will continue to support you as a community. As I conclude, I don't know whether you had any final remarks which maybe you may want to tell the audience before we close. Nyambura.
Thank you, David. For me, it's just to appreciate the Kajiado We Want platform for giving us an opportunity to talk to parents and just try to demystify some of the issues that we are facing as parents. And as I have mentioned, it's not hard. Yes, it might look like a challenge as a big issue, but if we are involved, we are responsive, we provide structure, then we can help our children. Again, I'll just want to reiterate the use of our toll-free number, which, as I have mentioned, is available 24 hours. There are counselors available on call who can either help in counseling a person, not just a young child, even adults who could have problems. Yes, thank you for that. So 1192 is a number we all need to have, because this is a number you can use to refer somebody who might need counseling services. But as I also mentioned, this is a number that we can use to report any complaints or any issues that we find within our community relating to alcohol and drug issues. So once again, thank you very much, David, as the chair, interim chair, as you said, of the Kajiado We Want, as well as Regina, Benjamin, Evelyn, for allowing us to be part of this and to just share the information that we have. Thank you very much.
Thank you once again, and God bless you for the good job you're doing. We will support you. We will pray for you. It is not easy. I want to thank my audience for listening to us, and we are sorry for the hiccup, mainly caused by network. Most of our members were dropping in, out, and we had to redo this presentation once more. We want to urge you, for those who may have left, to watch it and be enlightened. As we close, let me thank my team, Benjamin, my sister, who controls the system. Thank you very much, Benjamin, for being there for us. I want to thank Evelyn, our organizing secretary, for organizing these very insightful talks. I also want to thank Regina for being there, and the entire board of trustees for the Kajiado We Want CBO for being there and organizing these very insightful talks. As we close, I want to welcome you to Ololua Forest, Camp Jonah, where we shall hike and picnic. Come with your family, come with your pets, dogs especially, which needs to walk, and let us do the nature trail. And at the end of it all, we will be able to adopt a ground where we will do our bit as a community and plant and grow trees. I want to thank you as we close and to welcome you to other future episodes. For those who may want to participate, feel free to contact us. Thank you, everyone, and have a good night.
Thank you, David, and good night to everyone.
Thank you.